When is a death not a death? A joint investigation by CNBC and our partners at NBC New York found that medical companies are classifying thousands of patient fatalities as injuries. And the FDA says it's okay. They're referring to death by another name, but critics say it could mask real health problems. Investigative reporter Chris Glorioso has our story.
You know, we're still in shock. It's a never-ending nightmare. I'll never forget this. As long as I live, he called me. He said, "Nana, my mama has died."
She is a mother convinced this medical device played a role in her daughter's death. It's called the vagus nerve stimulator, or VNS. And back in 2010, Oklahoma's Shelley Wilhite thought it was the cure for her epileptic seizures. The device is designed to generate small electric shocks that block seizures. But 4 months after surgery, on a Friday afternoon, Wilhite's family says she started feeling abnormally painful shocks. With VNS, you're not supposed to feel anything.
She called me and said that it shocked her really bad and it almost dropped her to her knees.
Wilhite planned to call the doctor on Monday, but
she never made it to Monday.
She died on Sunday.
Wilhite's daughter found her dead on the bathroom floor. Her cause of death, cardiac arrest brought on by a suspected seizure.
I don't think we'll ever get over it.
Shelley Wilhite wasn't the only one complaining about the nerve stimulator. By the time she died, the Food and Drug Administration had received thousands of reports of problems with the device. And some of those reports had a startling discrepancy.
I absolutely had to do a double take. There are a lot of reports in there that really made me question the integrity of the reporters.
Madrice Tomes is a former FDA consultant who now runs a company called Device Events, which offers a simplified way to search FDA safety data. She scoured through 30,000 VNS safety reports going back to 1996, and she found 38 patient deaths reported as injuries or malfunctions. They include 5 patients who developed fatal pneumonia, but the deaths were labeled as 4 injuries and 1 malfunction. In another example, a VNS battery depleted with 0 years remaining. The patient died, but the event was called an injury.
When you saw a report that mentions a patient's death but was categorized as an injury, what did you think?
I was very alarmed.
Did you find that deceptive?
Yes.
Medical device makers are supposed to report any event that reasonably suggests a device may have caused or contributed to a death or serious injury. Checking the death box is not an admission of fault. Despite that, Tomes says companies sometimes downgrade patient deaths, arguing the fatalities are unrelated to the product. She says that can throw regulators off the trail of health hazards.
The way that the FDA reviews the reports is in order of importance by the classification that's checked on the form. And so if it's an injury or malfunction, it could take them weeks to months to get to reading them.
Cyberonics, the company that makes the nerve stimulator, said 3 of those pneumonia deaths were properly reported, and the other 2 reports were human errors. But the company also conducted an internal review, finding a total of 108 misclassified deaths, some going back to 2005. Cyberonics told us it never purposely manipulated safety data, and those errors comprise less than 1% of the company's safety reports, concluding there have not been any significant misclassifications.
But the vagus nerve stimulator is only one device we found with patient deaths listed as something less serious. We looked at 5 years of FDA safety reports and found more than 4,000 patient fatalities, all listed as injuries or simple malfunctions.
A knee injection patient developed a septic infection and died, but the event was listed as an injury. Another patient fell from a safety bed and died on the floor. That was called a simple malfunction. A stent was implanted, damaged, and stretched. A few hours later, the patient died, but again, it was listed as a malfunction. We asked the FDA about all of those reports and more. A spokesperson said the reports were likely classified correctly.
The FDA says this is not a problem. What do you say?
I think that when you have a lot of patients being injured and a lot of deaths occurring, that it's always a problem.